Hi everyone, I'm Xinting Wang. I would like to share my issue about autism to all of you today. The title of it is Treatment Dilemma of Preschool Children with Autism in China. First of all, I will provide the outline with you. The first one is background of autism spectrum disorders, that is ASD, in China. Then I want to argue the challenges in treating preschool children with autism in mainland China. The last one is expectations or available improvements in the treatment of autistic children. The introduction of ASD in China is divided into three parts, including the definition, history, and prevalence. Firstly, the definition of ASD is a group of developmental disabilities characterized by pervasive deficits in socialization and communication, as well as unusual behaviors or interests. Secondly, the history of ASD in China has several important points. In the 1980s, the first article on ASD was published in a Chinese journal, and in 2006, ASD was added to the Chinese government's list of disabilities. Recently, in 2017, inclusive education was approved by the Chinese government, but not compulsory. In addition to this, the prevalence in China is much lower than other countries and districts. For example, the prevalence of ASD in all over the world in 1 in 160 children. The data of the West is 1 in 100. However, the data of China is between 1 in 255 and 1 in 1,305 because of screening instruments and some policies. The main body of my presentation is the challenges of treatment of preschoolers in China. According to some articles, lack of ASD awareness and knowledge delays the diagnosis and intervention to autistic children. Besides, the stigma of ASD from Chinese families prevents parents or caregivers from seeking help and advice to some extent. In diagnosis and treatment, China largely relies on clinical judgment instead of diagnosis instruments. Then, diagnostic evaluations of China are inconsistently conducted because of lacking professionals and institutions. There is also a serious gap between theory and practice in intervention and treatment. For instance, evidence-based practices requires longer time to show effects, which is not favored by most professionals, although it is rated as one of the most effective methods. What is more, the expenditure of healthcare for autistic children is much higher than other children with different disabilities. But unfortunately, the cost of them is not included in the National Health Insurance Program. To alleviate or solve the dilemma of treatment for these children, there are 4 measures to be provided. The first one is that China needs a nationwide survey on prevalence of ASD, then using the unified screening skills for diagnosis. Thirdly, providing professional training for treatment group and preschool teachers. The last one is that providing funding and insurance to autistic children to guarantee them health care. Well, this is my presentation about my issue. Certainly, there are some limitations of it, so I look forward to your suggestions. Thank you very much.